Hi, I'm Dr. Jonathan Chung. I'm an upper cervical chiropractor with specialty training in chiropractic neurology, and today we're going to tackle the topic of craniocervical instability. Craniocervical instability is a condition in which there's a loss of integrity of the top cervical vertebrae in relation to how it connects with the skull. The loss of integrity typically is when the ligaments of the upper cervical spine are affected. These loss of integrity can come from an inflammatory disorder like rheumatoid arthritis. It could also come from trauma, like we've seen in patients that have a really bad whiplash injury or a concussion injury. There are also genetic conditions like Ehlers-Danlos syndrome, where there's a genetic weakness of the connective tissue of the body, where the integrity of the upper cervical spine in particular is a little bit weakened. And because of that loss of integrity, the spinal bones that move are actually moving excessively, which can put things like the brainstem, the spinal cord, and some of the vasculature at the top of the neck at risk. If the instability is bad enough, then you end up in situations like this, where there's actually surgeries that will actually fuse the upper cervical vertebrae to the skull to prevent that excessive motion. These types of situations usually only happen if that brainstem and spinal cord are in that high risk territory, and this can usually happen whenever you move your neck and you feel a situation where the person starts to lose consciousness, or they might experience really strong neurologic symptoms upon moving the neck and it starts to expand beyond the normal borders of movement that is safe for that individual. Having severe instability is relatively uncommon. There's not that many people that get to the point where they actually have to have their upper cervical spine fused. There are cases of instability where we would classify them as mild or moderate, where there is an excessive amount of motion happening at the upper cervical spine, but it isn't putting the brainstem or those vascular structures in direct threat, which could be a medical emergency. If someone is showing clear focal neurologic deficits or clear signs that there's a vascular problem, then the guidelines are clear that that person needs to have surgery in order to prevent a more severe loss of function or possibly a loss of life. When someone has mild or moderate types of instability, then the guidelines aren't necessarily that clear. These mild to moderate instabilities are usually diagnosed on an MRI that takes a stress view of the spine, or on a digital motion x-ray where the patient is getting a digital x-ray series where they can actually see the motion of the spine in real time. Although you can see the biomechanical implications, the clinical implications are not necessarily that clear because they don't line up with symptom trajectories all that clearly. Things like this, it's important to approach some of these cases with caution so you don't use excessive amounts of force to try to move something that is already hypermobile.